today I will be demonstrating how to insert a Foley catheter on a female patient. The supplies needed for this video will be clean gloves, a Foley catheter kit, washcloths for perinatal care, hand sanitizer for hand hygiene, the cadaver, as well as a bin to dispose of all used materials. After we gather our supplies, we'll enter the patient's room. We'll ensure patient privacy by closing the door or pulling the curtain. Then I'll perform hand hygiene and introduce myself to the patient. Hello, my name is Pranita and I will be your nurse today. I will verify my patient's identity using two identifiers. I'll ask the patient for their name and date of birth, where the patient will respond with their name and date of birth, and I will confirm with the wristlet that they are wearing. After patient identity has been established, then I will ask the patient if they have any allergies. Once that has been completed, I will let the patient know that the doctor has ordered for a Foley catheter to be inserted. I will educate the patient on how the steps of the procedure will go. I will let the patient know for proper positioning, and I will let the patient know how long the procedure will take place. I will ask the patient if they have any questions or concerns. They have replied no, so now we'll begin the procedure. First thing I'll do is apply my clean gloves on. Patient privacy has already been established. Once my clean gloves have been on, I will raise the bed to a workable position. I will ask the patient to rotate their hips and adjust themselves to a dorsal recumbent position. This is where the patient is laid on their back, their knees are flexed, and their feet are flat on the surface of the bed. I'll ask the patient to spread their legs apart so proper perinatal care can be achieved, as well as proper insertion of the Foley catheter. Once that has been completed, I will then put a waterproof pad beneath them. The patient will lift their hips up. This pad will ensure that the bed does not get wet or soiled. Now I will ask for consent for the patient, as I will need to expose them and touch them. The patient has given consent, so now I will expose the patient. Now that the patient has been exposed, the first thing that we will do is clean. We'll take our first washcloth, and this washcloth is soap and water. We'll take the first clean corner, and we'll start from the outer fold farthest from us of the labia, and we'll clean from top to bottom. We will find another clean corner and clean from the closest fold towards us from top to bottom. And then we'll take another clean corner and clean from the middle, top to bottom. We will dispose of this washcloth in our disposal bin. Then we'll take our next washcloth. This is just water. This will be used as the rinse. We'll take a clean corner and begin at the most outer fold farthest from us of the labia, and we'll go from top to bottom. We'll take another clean corner and clean from the closest fold towards us from top to bottom. Changing to another clean corner, we'll go from the middle, top to bottom. And we'll dispose of this washcloth. Next, we will take the last washcloth, and this will be dry. And we will take the clean corner and we will pat dry the farthest part. Pat, 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 pat. We'll find another clean corner, and we'll pat dry the closest flab towards us. Pat, 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 pat. And then we'll take another clean corner and clean the middle down, top to bottom, using padding. 1, 2, 3, 4, 5. Okay? And we'll dispose of this washcloth. Once that has been completed, then we will locate the urinary meatus. That is where we will insert the Foley catheter tubing. And we'll also do a skin integrity check. We are looking for any redness, any inflammation, any discharge, pus, or open wounds. Once that has been completed, we will dispose of our gloves. In the trash, and we will perform hand hygiene. For video purposes, I will place my hand sanitizer beside the cadaver for space. Once hand hygiene has been performed, we will now utilize our Foley catheter kit. We'll take it out of the packaging. and we can dispose of the bag in the trash. Now we will carefully open the Foley catheter kit using the folds. Start from the outer and then open up the sides. And the last fold towards us. Okay, now that our Foley catheter kit has been opened, we will first apply our sterile gloves. We'll place it on a flat surface and open up the packaging. There is that 1-inch border that we'll need to use. We cannot go beyond the 1-inch border, otherwise we'll break sterility. So open up our sterile gloves. And I will don my dominant hand using my non-dominant hand, and I will obtain the glove with the cuff. And I'll begin to don on my right hand, and I will use my gloved hand to scoop up and don my left hand. Again, we do not want to break sterility. Once my hands have been donned on with the sterile glove, we need to ensure that we cannot go below the waist, otherwise we will break sterility. And I will dispose of the packaging used for the sterile glove into the trash bin. Now that our gloves have been applied, we'll apply the blue drape. And the shiny side will go on the ground. We cannot touch the patient. The patient will need to lift their hips up so this can go properly in. Once the blue drape has been placed, then we will get the fenestrated dressing and place that on the patient. Alright, now we'll prep the Foley catheter. So we'll take out the kit. We have our swabs. The package is open, and we'll have it ready to clean the patient. Next, we will apply the lube onto the tray and dispose of this in the trash. And we will then set up the Foley catheter. We'll insert the syringe in the Foley catheter. We'll take our syringe and we'll open the cap, dispose of this in the trash, and then we'll place the syringe here. This will help inflate the balloon once it is placed inside the patient. And now that that has been set up, we will lubricate the Foley catheter tubing. So we will take the sleeve out for the tubing and dispose of the sleeve, and we will begin to lubricate the tubing. Once the tubing has been lubricated, we will begin to clean the area. I will ask the patient for consent again. May I please have consent to touch you and clean your peri area once more? The patient will give consent, and I will begin by using the first swab. I'll be using my non-dominant hand to touch the patient, and once I touch the patient, I can no longer use this hand as it is not sterile. It will not be able to be used to touch any of the equipment. So now I will touch the patient, and I'll begin cleaning the outer fold farthest from us, from top to bottom. I'll dispose of this swab. I'll take out the second swab. And clean the inner fold closest towards us, from top to bottom. And dispose of this in the trash. And I'll take the last swab. And go from the middle downward, ensuring that the urinary meatus is cleaned properly. And I'll dispose of this. I'll dispose of the packaging. Now I'll let the patient know that I'll be spreading their folds, and we will begin to insert the catheter tubing. I will let the patient know that there will be a little discomfort, but that will go away. And we'll begin to insert the tubing. This will go 3 to 4 inches in the patient. And once we begin to see urine, then we will advance another 1 to 2 inches. And after the Foley catheter has been in place, we'll tug, and I'll use my non-dominant hand to hold the tubing in place while I begin to push the fluid in to inflate the balloon. We'll do it at a pace so that the balloon does not expand quickly and pop. Once all the fluid has been released in, then we'll remove the syringe. And we'll dispose of it in the trash. After that has been completed, we'll take the catheter bag. We'll place the tubing bifurcation to the patient, and we'll place the bag below the bladder onto the mattress. And after that has been completed, then we will clean up our supplies. So I'll place the bag right here. And we will clean up the patient. And we will clean up our workspace, ensuring everything is properly disposed of. I will then cover up the patient. I will thank them for their cooperation and allowing me to care for them. I will raise or lower the bed to the lowest position, ensure patient safety, that there's nothing that the patient could fall from, have the call light in reach, and I will then ensure patient privacy. Then I will take off my gloves. And then I'll ensure patient privacy by closing the curtain or the door. And I will document my findings on what the urine appearance looks like, what consistency there is, if there's any particles, and I will also note how much output there was in the catheter bag, and I will also document the procedure performed. Thank you so much.